Day at 3 p.m. here on WBAI New York, 99.5 FM, and WBAI.org online. Stay tuned now for Take Charge of Your Health. Coming up, it is 4 p.m.
Hi, this is Take Charge Your Health with Corrine Fernari, clinical nutritionist, physician assistant, and Carol Peterson, pharmacist. Listen, learn, and I hope you enjoy the show. Bye.
Welcome back. This is Take Charge of Your Health with Corrine Fernari, clinical nutritionist and physician assistant, and my co-host, Carol Peterson, pharmacist. Every week, we present you with new and creative ways to help you make sense of health information and bring it home to you and your family. With years of clinical experience between us and research into traditional and cutting-edge technologies, we give you practical information to help you take charge of your health. Welcome back. Welcome back.
Oh, good to hear you, Corrine.
Oh, good to hear you, Carol. Took a second, but so today we have quite a good show. We have an exciting show. I'm excited, and we also have a guest who's a friend of Take Charge of Your Health. You might remember him. He's been here before, but unfortunately, it was before the pandemic, wasn't it? That he was last on the show, and so it's been a
I
little
think it
while,
might have
but.
been. Yes.
Yeah, it's been a little while, but I'm so glad to have him back. We're going to focus on something that we've focused on before, but we're going to go into more depth, more understanding, and that's progesterone, the female hormone that's
No.
secretly fueling the men's health. Because
Men's
when you
health.
hear the word progesterone, your mind probably jumps straight to the female biology, linking it to the menstrual cycle and pregnancy. It's widely known as a quintessential female hormone. But what if that's only half of the story? That's the truth is men not only produce progesterone, but it's also critically important for their health in ways that are both surprising and quite profound. That's what we're going to be discussing today. This often overlooked hormone plays a number of impactful and counterintuitive roles in the male virility and vitality. Carol, would you introduce our guest for us, please?
I sure will. First of all, I want to make sure he's here. Dr. Weeks, are you with us?
Yes, and what a pleasure. Corrine, nice to hear your introduction.
Okay.
Oh,
I want to give a short bio for Dr. Brad. I just asked Perplexity to help me. And, in about 10 seconds flat, I have this wonderful thing. So it says Dr. Bradford Weeks, MD, is a pioneering integrative medical doctor based in Washington State with over 40 years of experience. He is the founder and medical director of the Weeks Center for Corrective Health on Whidbey Island, where he focuses on empowering people to optimize their health through targeted nutrition and integrative approaches, aiming to reduce the need for medications. Dr. Weeks trained at Dartmouth College and the University of Vermont and with a residency in neurology and psychiatry at Dartmouth Hitchcock Medical Center. He is known for his work in corrective medicine and psychiatry and his principled stance on healthcare freedom, having successfully challenged the Washington State Medical Quality Assurance Commission for unjust actions against his medical license. Wow.
yay.
Dr. Weeks also advocates for safe, effective, and cost effective treatment protocols beyond conventional pharmaceuticals. Wow,
Per-
isn't that lovely?
Perplexity is pretty talkative today.
Okay, Okay, Dr. Brad, do you have any corrections to that?
No, but I do think, Carol, we haven't been on this show since before COVID.
Yes.
During COVID, I hope your listeners appreciate there was a very clear and very damning scenario where most of the medical health professionals were not acting in the best interest of the patients. And so there were some pioneers who got whistleblowing activity against some of these institutions, and they got their licenses suspended, and they got a lot of things. And, you know, we'd been through that back in 2013 prior to the COVID. So I had a lot of empathy for these doctors who had a lot of integrity, who stood up to the mandates and so forth. But it is kind of a feather in my cap. A lot of my patients say, "Are you the doctor who had your medical license taken away by the board?" And I say, "Yes." And they say, "Well, I want you to be my doctor." So it's a simple process. We on this panel understand that the principles of health are not complex. And I like to remind people it begins with our thought process. So whatever your biochemical challenge, the way you think about it has a real and significant effect on how you behave, how your biochemistry. Our thoughts create our feelings, and our feelings create our biochemistry. So I always, for any hormonal problems, I start with the thought process, and then we look at the habits of life, the vitality. Are you sleeping well? Are you eating well? Are you exercising and getting out of breath? Or do you have sleep apnea? It's not a benign process. So those kind of life forces are important to figure out. And then we can get down into the biochemistry. And I have a lot to share today on progesterone, but I'd rather have you guys ask me questions or make sure I'm serving your audience.
Well, I have no doubt you will serve the audience beautifully. But I'd like to just interrupt and say we are live on YouTube right now. So you can type in questions and we'll be able to answer you. And also, I've put a quiz up on
On YouTube?
progesterone, on a quiz on the Progesterone for Men Facebook group. And the question is asked on progesterone. I'll give the answer tomorrow. It's going to be a 10-day quiz. So listen closely because the answers are going to be here. So I'll go back. Dr. Brad, please, I'll let you go on.
Oh, wait a minute. Give out it's the YouTube is Take
Oh,
Charge of Your Health Radio.
yes,
So make
thank
sure
you.
you look for that. That's where you'll find us.
Thank
Okay,
you.
go ahead, Corrine.
So mostly up until just recently, the word progesterone has been literally associated with female. Do you know how the awareness has come about that how essential this is now for males?
Well, I know some of the story. Of course, a lot of it might be serendipitous or fortune, but as you mentioned, progesterone was really discovered initially in the corpus luteum aspect of the female anatomy, and it was found to have the benefit of helping a pregnant woman carry her baby to term. And so it was called progestational or progesterone. And so 60 years ago, everyone thought it was a female hormone. Now we know that every nerve cell in the human body has progesterone receptors, and we know that it has a myriad of clinical benefits. One of the most important of which is what we call, generally speaking, neuroprotection. And there's many agents which protect the neurological cells. Vitamin D does that, melatonin does that. Vitamin C to a certain degree will do that, vitamin E, of course. So there's many things that lithium can be helpful in low doses, many things that protect the nerve cell. But what does it mean to have neuroprotection? It means that when it comes time for you to get MS or Lou Gehrig's disease or a stroke or Alzheimer's, your odds of suffering with those illnesses are less if you've been supplementing with progesterone. So we know that progesterone has some very beneficial benefits, and I'll summarize them just briefly. It has a anti-estrogen benefit, and people who are estrogen dominant, that would be men with man boobs or obesity in the belly, so they carry a lot of fat and a lot of estrogen in the fat. But people who have estrogen dominance, like those middle-aged dad bods with the man boobs, and also women with premenstrual tension and all sorts of difficulty with menopause, those are often remedied by progesterone because it has a countering effect against excessive estrogen. And just to be clear, excessive estrogen can be the normal amount of estrogen in the absence of adequate counteracting progesterone. So you don't have to have high estrogen to be estrogen dominant, but you can have low progesterone, and then whatever estrogen you have is too much. So one is the estrogen. The other thing which is very valuable is progesterone helps with weight loss. It helps with blood sugar stability. It helps reduce the very deleterious hormone called cortisol. And when you have adequate progesterone, you make less cortisol. So that helps with weight loss and stress and immune function. The third thing that progesterone does, which is maybe its most popular benefit, is it's what's called a beta blocker. It blocks adrenaline. And so when you have progesterone on board, things don't stress you out so much. You don't get frazzled. You don't have, erratic thoughts or mood swings and so forth.
I
It's a
just, if I could interject here, that beta blocker effect is the beta receptors are those for adrenaline, and adrenaline keeps you hyped up and your blood vessels constricted, anxiety, heart palpitations. So that adrenaline effect is really strong. And I'd like to just point out that 3 whole classes of blood pressure medication are designed to interfere with adrenaline doing that type of activity. I just saw, just curiously, I think I saw it on Mercola. He's pointing out that beta blockers like propranolol are actually not good for your health long term. People are being told because of hypertension that they have to use a drug like a beta blocker. They do not get better quality of life or length of life with using this drug. So that's coming to the forefront just now. People are speaking about we're going after high blood pressure, but that high blood pressure could be caused by high adrenaline, which progesterone serves very well as a balancer for that high adrenaline.
Progesterone also is a vasodilator, so it increases circulation throughout the body without and relaxing the arterial system. So you're not getting the hypertension, and you're getting the increased circulation. And
let,
that's go,
I
please.
was just going to say, let's take a moment to clarify the main skeleton in the closet or the elephant in the room, which is that progesterone is not in any sense similar to progestins. Progestins are the pharmaceutical patented knockoff near miss of bioidentical progesterone. And progestins have been implicated in stroke risk and heart attack risk and other things. So progestins, Corrine, what you just said was right about progesterone helping with the vascular system. Progestins do the exact opposite. Progestins make you retain water, increase renal stress, increased hypertension issues. Progestins, there's the old commercial we might have seen 30 years ago when Mother Nature's on the TV and somebody tries to give somebody not butter, but,
Yeah,
margarine.
you can't fool Mother Nature. Yeah.
Don't fool Mother Nature. I got to tell you, that stays with us. Don't screw around. If you got something like progesterone, use it. Don't buy the synthetic knockoff variant, which is toxic.
Okay, for men, they are almost universally offered a progestin called finasteride. Dr.
Yes.
Brad, would you like to expound on that a little bit?
Well, that's very significant. Finasteride is
Very
actually
important.
finasteride is a derivative of progesterone. It's a metabolite, so to speak, of progesterone. It's a synthetic patented version, and it has the real effect of lessening prostate size. Now, if if the derivative of progesterone lessens prostate size, wouldn't it be worth testing whether the progesterone itself lessens prostate size? Now, I'm 68. I'm starting to understand what my patients have been telling me for the last 40 years. It is not fun to go to the bathroom and just pee for a tiny amount and then go back to the bathroom and pee again. As the prostate gets acting up, it is a real benefit for men to take progesterone. And what I like about progesterone typically is the cream version. I formulated a cream version of progesterone, but we put that right in the rectal area, in the anus. A topical application of that goes right to the prostate, which is very beneficial. So it's important for prostate support. It also lessens the conversion of testosterone to the worrisome strong metabolite called
Right.
dihydrotestosterone. So it makes you have more testosterone because it prevents the deterioration of testosterone to DHT. So men, this is a trifecta. You can have more energy, more virility, your prostate will behave, and you'll have adequate testosterone if you're doing this progesterone piece. It also maintains lean muscle, and as I mentioned before, it lowers cortisol and stress levels.
My
So
goodness.
that finasteride is also being offered to young men who are balding.
For hair,
Right.
for hair loss.
Yeah. And the nice thing about a progesterone cream, you can rub it right into your scalp. I do that every night.
Oh, show us your head.
Looks pretty good, I must say.
Oh, yeah, not too bad.
Well, it's better than
Not,
it was. No,
uh-huh.
it does work. And these aren't just speculations. We know that finasteride helps with hair growth, hair regrowth, and so progesterone would too.
Yeah, definitely. So when you're talking about using some progesterone cream in the rectal area for men, what kind of doses are you using usually?
Typically, it's 40 milligrams of progesterone at night.
Okay. Dr. Platt, who was on our program before, he likes 300 milligrams.
Yeah,
Um,
but remember, progesterone is fat soluble, so it will accumulate. But
uh,
also, people notice the benefits pretty quickly. They get better nighttime sleep and such.
right, right. Which I've seen for men. There's an older article with progesterone for men. Like I think it said, progesterone, the forgotten hormone for men, and there was a 200 milligram oral dose for better sleep.
Yeah, it can be taken any number of forms. People need to try what's best and what's most cost effective. But science is clear and endorses using it for these indications.
Yeah, that's
Now,
what I always say. Progesterone in any way, shape, or form, but the progesterone is the important part. Not
now, progesterone is a neurosteroid for the brain. They say it reduces inflammation, it promotes neurogenesis. That's the creation of new brain cells. It offers neuroprotection, so it's protecting the brain cells. It's protecting the brain against dementia, Parkinson's, Alzheimer's, and it shows a promise in repairing myelin, the covering that goes along around the nerves. Have you worked with progesterone on that level at all? Have you seen
Oh, yeah.
results like this?
Yes, and it's very true. The other thing about the neurogenesis piece, let's talk about osteoporosis, which women are more concerned about than men, but men also can get significant osteoporosis. Now, the two hormones we think about for bone metabolism are number one, estrogen, which prevents the breakdown of
Down.
bone. But
Mm-hmm.
progesterone does the opposite. It actually increases the buildup of bone. So it's
Mm-hmm.
not only neurogenesis, it's bone regenesis as well. You'd want to take it, of course, with vitamin E and vitamin D and so forth. Maybe some boron and some calcium and
It's
magnesium.
okay. And
Oops, it's a big list.
it's a big protocol all of a sudden.
But I led with this, Corrine, because the neurogenesis piece, as I mentioned, it's neuroprotective. So we all, as we get older, we're more susceptible to neurodegenerative processes, whether it's a stroke or whether it's a TIA or whether it's just, tremors and so forth. Progesterone has been found to be helpful with epilepsy, as an
Yep.
example. So we think about neurogenesis and neuroprotective agents, and it should be a part of everybody's protocol to be buffering themselves against the bad eventualities in the future.
We got our first question on YouTube. The question is, can progesterone be capsule or does it need to be cream?
No, it can certainly be capsules or drops. A compounding pharmacy can deliver whatever dose that doctor wants this patient to have, but over the counter, it can be in a cream form.
Okay, I mix my cream with some iodine when when I'm giving it to women and men. And so I put a couple drops of liquid iodine and then they use that, and I find that incredibly beneficial. I do it all the time, but I particularly do it if there's any hyperplasia, and
Yeah,
people get very quick responses.
lovely. Iodine is a forgotten element, of course, very beneficial. So good for you to be doing that, Corrine.
I recommend it almost all the time to my clients. One of the things that's not readily apparent, but we're in the ballpark here, is that you need iodine to help convert the more stimulant estradiol and secondarily estrone. You need iodine to get to estriol, which is the hormone, the estrogen of excretion, and it's much less proliferative than the stronger estradiol. So if you happen to have an accumulation of the stronger estrogens, you're not detoxifying very well, and iodine is a piece of this puzzle.
And also, Carol, it also brings up the whole role of progesterone's benefit to optimize thyroid hormone function. And that's an important
Exactly.
piece. And the last component to that, after COVID, we have a lot of post-COVID syndromes. We have a lot of clot pathology. People are getting strokes and clots. And progesterone helps normalize blood clotting parameters, which is a very nice benefit.
We did a deeper dive on that in one group I'm in. And actually, Jeffrey Dash has it in his book, Bioidentical Hormones 101. His second chapter goes into the clotting issue, and it's probably the second most asked questions about hormones, first cancer and then clotting. And as it turns out, the evidence for clotting only occurs with progestins. As you mentioned before, the slightly altered progesterone molecules. So when you alter the molecules, you lose that protectiveness against clotting that progesterone offers. Also, it's really well, and medroxyprogesterone acetate, which is commonly used or known as Provera, has been commonly used, and norethindrone acetate is one of the knockoff progestin molecules have a high propensity to increase blood clotting. And then in birth control pills, the estrogen, the ethinyl estradiol, now we have a knockoff estrogen, is
Oh, great.
really causing more clotting. So if you're sticking to hormones as nature made, you avoid all these problems that we've introduced by altering molecules.
That's
The
so true.
Yes, the progestins are vasoconstrictors, and they saw that in the women's studies where they gave progestin and then they gave a supplement that created vasospasm, and those that were on progestins would go into a spasm, and couldn't get out of it. They were with monkeys, and they would see them. They couldn't get out of the spasm. And those that had progesterone didn't have a reaction to what they were giving.
And
So,
and and I think those monkeys who were going to die, they rescued them with progesterone.
yes,
Yes.
exactly.
Yeah,
Exactly.
I need to look at
that's
that study again. Have you heard that study, Brad?
yeah,
It was the
and
follow up to the women's study.
yeah, it's so interesting in my career, Corrine. I've become more transparent to my patients about my job is to figure out what medications are helping them, and then swap those medications out for naturally occurring substances with no side effects. But
So
many people still, we've been so brainwashed as a culture in the US, many people feel if the doctor doesn't give me a prescription medicament, he's not really working for me. He's not really being helpful. We're so brainwashed to value a prescription medication when in fact they never fix any problems. They simply suppress symptoms. They don't get to the root of any challenges.
yeah,
So,
you're not taught to do that. I think it's crazy that we all in the medical profession we have all these requirements for biochemistry, physiology, and we're supposed to learn how to maybe even anatomy. We're supposed to learn how the body works, and then as soon as you get in the professional school, out the door, all all the things you learned, and now you're given I call it spreadsheet medicine. So if and you can put this on a computer, so I think doctors are going to be AI'd out of existence soon,
yeah,
since you can put this in a spreadsheet. If you have this, do this, yes or no, and just go down the flow chart of stuff, and the
Exactly.
the AI will give you the right drug to use.
Yeah. You
Just
real you really don't need the doctor, because if you don't follow the flow chart, you jeopardize your license.
correct.
So,
right. Right. So
as you know,
why don't you give us some examples of
well, guess what?
what? Oh,
We
we
have
have
a
another question.
listener. Someone called in. Someone has the number from last week. So, hi, you're live. Your name, please. Hello?
Hello?
Hi, can you please speak up?
Yeah, James is my name.
Oh,
Oh,
hi,
hi, James.
James. Welcome back.
Thank you. Can you spell your guest's name and tell us if he's written any books and what the name of the books are?
Okay, well, tell Brad, Dr. Brad.
Yeah, so
Weeks.
my name is Brad, Brad, and the last name is Weeks, Weeks. And the website is simply weeksmd.com. And I have written no books. I've written articles and chapters and books, but I haven't been attentive to putting all those in writing. So no books yet.
Okay, thank you. Any
Yeah,
books you
you're
can
very
recommend?
welcome.
Pardon?
Any books you can recommend?
Oh, lots of books. But what are your interests?
My interest is what you're talking about.
Well, if we're talking about
Hormones.
progesterone, Michael Platt, Platt. Carol, what's his book called?
Something about natural hormones. He calls it natural back then. And
If you,
he's written a great book called Adrenaline Dominance, which is
Yeah, the
very, very
adrenal
helpful.
dominance.
Both are very good, and you can find that. I think plattmd.com.
And then Hormones 101 by Dr. Dash, but that is, if you're planning to treat people, it's very in
Okay,
depth.
it's very
Very in
dense,
depth.
but we don't have a book. Um,
Well,
Dr. Brad, why don't we collaborate and write the Progesterone for Men book?
oh, that would be
that would
something.
be
I've
great.
got this book right here,
Which
and
is
this is
what?
an older book, and I was looking up things, and this is by Jonathan Wright. Stay
Yep.
Young and Sexy with Bioidentical Hormone Replacement. And it was written in about 2000.
You know,
And it's
Jonathan,
still good.
yeah, Jonathan was brilliant, and
Exactly.
was a mentor of mine. I worked with him for 9 months when I first got out of my residency, and it was a great fellowship with him. He's whatever he writes is very valuable.
It
Yeah.
doesn't age.
Yeah.
Well, that's the best thing. People always want to know if there's something new and exciting. And I think the good old stuff has stood the test of time. And that's probably what we should be looking at. So tell us, Dr. Brad, why don't you give some examples of somebody coming to you and they're already on some drug protocol, how you would work with them and identify what's going on, and how you could fix their biochemistry so the drugs become moot.
Yeah. So, Carol, that's a simple process, really, of not stopping the medication initially, but adding the supplement which will replace the medicine. So, rather than saying medicine bad, stop it now, we say medicine suboptimal, let's give you the right stuff for a week or so, and then we'll start cutting the medication in half and then half again. So it's a process where you put the supporting nutrients in place first before you try to try to get someone off of medications. Then, when we look at the men I see in my practice, I'll say a good percentage are cardiovascular. What can kill you? It turns out with a heart attack, it's not commonly found that there is an obstruction. We think about a heart attack as a blood clot in the heart, which compromises blood downstream. But it's mostly electrical, it's mostly arrhythmias which cause the fatal heart attacks. And what has driven that? That's being driven by adrenaline. So progesterone is an anti-adrenaline, relaxing, vasodilating agent. So men with cardiovascular disease, they deserve the transdermal progesterone, 40 milligrams of progesterone and 40 milligrams of DHEA. And that's something they do once a day. And then people with compromised cardiovascular in terms of the brain function, like up in the strokes or the cerebral ischemia, those people need the neuroprotective effects of progesterone, so that works with them. My men who are coming in with prostate cancer all get transdermal progesterone for the reasons we talked about. It's anti-cancer. It shuts down the pro-cancer gene. This is what progesterone does, and it helps there be less risk of prostate deterioration. Um, so when I think about the men in my practice, it's going to be cancer and heart disease. And then, of course, the metabolic syndrome. So many of Americans are
Yes.
obese. And the metabolic syndrome, again, since progesterone lowers cortisol, and since cortisol drives the metabolic syndrome, we're in a situation where progesterone can help people get thinner and more vital and have less diabetes risk.
I find it one of the biggest problems with hormone disarray. Um, Ben Bickman says 88% of the population has insulin resistance, i.e., metabolic syndrome, and it throws off all your hormones. And
Everything.
I have a great problem with people just checking a few sex hormones to check for deficiencies and don't look at the whole picture. And insulin glucose is probably my primary two hormones that I consider first. I'd like, if I could just switch back to where you were and maybe tap into your background in psychiatry, because a lot of people come to me, and I think Corinne will agree, they come on Ritalin, antidepressants, benzos. Do you have any advice for helping those people? I agree entirely. You need to help nutritionally and hormonally before you touch anything. But do you have any pearls for us?
Well, when I formulated the progesterone at 75 milligrams for women, which is a high dose, I called it Calm Cream, CALM, Calm Cream, because the most pronounced immediate benefit of progesterone is you just feel, don't worry, be happy, you're in the zone, less anxiety, less stress. And that's something which people notice very quickly. So many of us, for all sorts of reasons, are either running on empty or being subjected to too much environmental stress, whether it's electrical pollution or Wi-Fi, whether it's fluorescent lights, whether it's excessive sugar in our diet, which sets everything off in the wrong way in terms of immune response. So you want to have more of a Zen approach to life, and this is kind of Zen in a bottle in a non-addictive way, because it basically stimulates what's called the GABA receptors or the relaxation receptors.
I want to talk about, I want to extend that a little bit in our body's ability to make progesterone. And to make progesterone, it starts from cholesterol, it moves into pregnenolone, which then becomes progesterone. So, what do we need? We need magnesium. Yet we know the nation is deficient in magnesium. I think the last statistic I heard, but I didn't look it up before the show, was 60% of the population is deficient in magnesium, which is found in avocados and found in leafy greens and found in pumpkin seeds. And also, guess what? In dark chocolate. It's found in dark chocolate. We also need zinc. Without zinc, the conversions are not going to be made without adequate zinc, and that's cholesterol to pregnenolone to progesterone. And that's found in shellfish. Zinc is found in shellfish, oysters, pumpkin seeds, sunflower seeds, and red meats. But also, we need B3, and that's found in nutritional yeast, red meats, B vitamins. But then there's some common products that block cholesterol and block cholesterol converting, being able to be converted. One is statin drugs. They're trying to suppress and suppress and suppress our cholesterol to such a degree that we're not able to convert and make hormones. When chronic stress, we've been talking about that, counteracts with supplements. You would counteract it with supplements like ashwagandha, vitamin B1, rhodiola can all benefit. Also, high insulin, which Carol was talking about, the metabolic syndrome. When you have high insulin, your body urinates out very high amounts of magnesium, which creates a circle and makes it so that we cannot create the progesterone that our bodies need to relax. And refined carbohydrates are a big problem. Alcohol, I hate to say it, but alcohol is a big problem also. And we know that people who have excessive alcohol have low testosterone levels. Inflammation, vitamin D helps inflammation. Very powerful. 10 to 20,000 international units daily. And endocrine disruptors found in plastics and pesticides and personal care products. They're hiding in there. And so what would we do? We consume cruciferous vegetables, which help the body cleanse, and use water filters to help mitigate the effects of what we're getting in our water. So that's a base of what we're dealing with.
You know, that's such an excellent summary, Corrine. And I'm glad it's being transcribed or being committed to the airwaves. But you're absolutely right. There's so much that can be done, but there's often a disorganization about how to administer protocols. I can tell you that cholesterol, we now know that high cholesterol protects against Alzheimer's. So all the bad information we heard about cholesterol is really a misstatement. And here's what I mean by that. Cholesterol in and of itself is nothing but good. It's beneficial. In fact, we know that we make our vitamin D when the sun hits our skin and hits the cholesterol receptor. The energy from the sun converts the cholesterol receptor, the cholesterol molecule, to vitamin D3. So we see that vitamin D has been praised around the world. How can it be that cholesterol has been demonized? And the answer is cholesterol, if it gets oxidized, if it gets rancid, like anything, if it gets spoiled, it's bad for you. So I would say bad cholesterol is bad for you, good cholesterol is good for you. And lastly, I hope your readers and your listeners understand that the food amount of cholesterol, the amount of cholesterol in the steak or whatever you're eating, in no way increases your cholesterol levels in your blood. The cholesterol in the blood comes from liver metabolism, not from the foods we eat. So if we could get off, there's a couple of big principles here, Corrine. One is stop demonizing cholesterol. Understand that the higher the cholesterol, the longer the lifespan in all nations around the world. That's been studied by the international cholesterol skeptics.
Can you
So,
repeat that? I
yeah,
think we need to hear it loud and strong.
yeah. Well, you know what would be fun to do? I'm gonna just go ahead and read the actual report quickly.
I didn't mean to interrupt you. I'm sorry.
No, not at all. But I want to. So here it says. Um, so first of all, it says. All right. Um, this is from Karger. This is 2018. We have confirmation of this revolutionary insight that high cholesterol is protective. And here's a direct quote from the study. Elderly people with the highest cholesterol levels have the highest survival rates, irrespective of where they live in the world, period. So
Oh,
Japanese, Russian, Tibetan, doesn't matter, South African, the higher your cholesterol, the higher your survival rate.
wow. Beautiful.
Profound. So what are we doing? Killing us softly with statins, slowly and steadily. Really trying to get rid of this prime molecule. Cholesterol itself is a profound antioxidant in its own right, and anti-inflammatory. So when you're getting rid of that stuff, and I love. I think I heard Dr. Tano say they also demonize LDH. That's the so-called bad cholesterol. It's a carrier protein that is taking cholesterol to your cells. It's when your cells need it. It needs to go into the nucleus where you can make the hormones. It needs to repair the membrane. Something like maybe you can correct me, Dr. Brad. Is I think something like 80% of the cell membrane is composed of cholesterol. So what the heck are we doing? Like driving it down? We can't repair our own bodies.
Yeah, you're absolutely right, Carol. The um, the LDL cholesterol, the HDL is considered good cholesterol, LDL is considered bad. That knowledge is obsolete now because now we have to look at lipoprotein fractions. Good cholesterol has good and bad components, and bad cholesterol has good and bad components. So you want to be able to see what's happening. But you mentioned that cholesterol is a carrier molecule. It's because it allows things to become soluble in the plasma.
Yep.
It can go around. And we noticed that the LDL cholesterol, the vector is from the liver to the peripheral cells. And the good cholesterol, the vector is from the periphery to the liver. And the reason they called it good and bad was simply a misunderstanding about traffic patterns. Just the way we might think a congested highway is bad, anything that anything that increases congestion is bad. That's what the LDL was doing. It was going from the center, from the liver, to the periphery, increasing traffic in the periphery, and therefore it was called bad. There was no other reason why it was called bad initially. We now know that the LDL has more of a predisposition to stay in the endothelial lining of the cells and cause problems like mast cells and foam cells and so forth. But for the most part, it's superficial. If you're a doctor, in fact, ever since around 2000, if you had a cardiovascular challenge and your doctor did total cholesterol, triglycerides, HDL, LDL, that should be malpractice. That's totally that's totally ignoring all the science that's happened between. You need to get your lipoprotein little a and apolipoproteins and so forth. You need to get all those done as well if you're concerned about your cardiovascular risk.
We have another caller. We haven't even given out the number. This is wonderful. So, hi, you're live. Your name, please.
Hey, how you doing? Kareem, and I get that late. Oh, Carol, right? Yes, because I'm a long-time listener and supporter of
Could you
BAI.
please speak up? I'm sorry.
I said hi, good afternoon. This is Jay from Harlem. Can you hear me better?
Hi, Jay from
Hey,
Harlem.
Helen.
Okay, yeah, I have the number in my phone. You know, what I'm saying? I'm not on speed. We don't have speed dial no more. But I'm just saying, yeah, because I'm a long-time listener and supporter of your program, BAI, many programs. So yeah, I
Thank
want
Oh,
you.
to two-part. Oh no, absolutely, absolutely. Um, I have a two-part question, and that is one for a healthy 50-year-old who most people just don't believe it, and I feel I don't feel it either. Whatever that feel like. Well, I guess there are certain days. I need to catch up with sleep. I said, well, 50 feel like. I think I'm 50 today, but for the most part, late 30s, early 40s. That's it. But yeah, I want to know what about a suggestion for progesterone? Because we know about the testosterone, but I'm saying like just think about the balance and what y'all was saying. So what is a suggestion and how to supplement for it and where we could get a good a good place or suggestion, naturopath or clinical nutrition, someone to suggest how to supplement it. With number two is on your about the next thing talking about the heart. Oh, the cholesterol. So for I mean, this is more for my mother who's in late 70s, does have some heart conditions. Has been doing very well lately in the past couple of years. But we had some scary moments in times before that. But with some certain changes and we introduced certain supplements to her and just those lifestyle changes in her life,
Okay.
even her moving more. I'm saying, how would I incorporate the whole cholesterol thing for a person like her? She's not on the statin right now, but hoping that she don't get put on it. How could we regulate and get her to someone, even yourself,
Okay.
if that's the case, and put your information on? I would like to set up an appointment.
Okay, Dr.
Ask her
Weeks.
honestly.
So,
Yeah. So what I do, what's the gentleman's name again?
Jake or
Jay, come
Jay?
on, Jay.
Jake.
Jay.
from Harlem,
Jake. We
good
do
music.
as a medical doctor, I'm not licensed to practice in Washington, I'm sorry, in New York, but I can do what's called health coaching. So if you wanted to be in touch with our clinic, we can set up a virtual Zoom consultation where I could get your questions answered and make some suggestions. So that's one thing. And the email address is simply MD for medical doctor at weeksmd.com. And just email MD at weeksmd.com and request a Zoom consultation. We can set those intake forms and get your mom taken care of. But in general,
Do you take
there's not
healthcare? Do
a,
you take healthcare or is it just cash?
okay,
Just
Well, no, excuse me, that's not, we'll talk about that. You talk about that
Yeah,
on the
there's some
phone.
technicality, but
yeah,
yeah,
Okay, go
yeah.
on,
find out.
but
Dr. Weeks.
the thing you have to pay attention to is that this is something that I believe to be foundational. I mean, everybody, no matter what if they come in with a chief concern of Crohn's disease or diabetes, I'll recommend number one, foundational supplements, which include good water, no fluoride or chloride, and
Mm.
good proteins and bioavailable proteins and good digestive forces. Foundational things, one of which is melatonin. I believe everybody should be taking high dose melatonin at 60 milligrams. And I believe things like what Karina said, the magnesium and the iodine and the selenium and the zinc, the good multivitamin is foundational. People can't trust that they're getting good nutrients in their food anymore. As we all know, there's many food deserts where there's malnutrition despite a lot of calories being consumed. Remember, just because something's edible doesn't mean it's food. So you could be getting transdermal progesterone. It would make your life better, I believe, and your mom would benefit as well.
Right, has to be
Thank you so much.
like
Thank you for
glyphosate,
your
right?
call.
You have to
We
say
have another question here that was sent in through YouTube, and she is saying, or they are saying, the dose suggested for men sounds low and is less needed for men rather than women when they have lots of stress.
Well,
um,
remember the reason why.
200, 300 milligram being given for prostate issues, is that too high?
Well, the thing is, if you're taking progesterone orally, you'll go through the liver and it'll destroy the progesterone about 80%, what's called first pass metabolism. So even though you might have, you know, um, 100 milligrams of progesterone, you'll only get about 20 milligrams bioavailable. So when someone takes 100 milligrams and they're only getting 20, if they're taking 200 milligrams, they'd be getting 40. And that's what we give in the transdermal, which has no liver metabolism issues.
Okay, I heard when in looking up and preparing for this today, they were talking about progesterone creating the sluggishness in the liver, and so people with chronic fatigue or severe fatigue problems should be careful when they're or keep very low doses of progesterone. But that would be if they're taking it orally, isn't that the case?
Yes, but remember, progesterone it blocks the adrenaline, it blocks the excitement. So sometimes people who are sluggish and weary, they're not having an effective adrenaline boost. They might drink a cup of coffee and not feel much. So we have to figure out why they're feeling sluggish. I don't, Progesterone rarely can cause in excess dosages a clinical depression, but we've never seen that in the 40 years I've been doing this. So there is a component here, which is that if you're having a sluggish or fatigue, blocking adrenaline can be counterproductive.
Interesting. That is why it's important to work with someone who understands hormones. Just to go out and just use it sometimes when there are complicated health issues, it could be counterproductive. Working with someone who really understands the hormones can be very beneficial, and you can get wonderful results that way. Now, guess what? The saddest part of the day has just come about. Dr. Weeks, it's just such a pleasure. It's a pleasure to see you, and now being able to see you and having you back.
Well,
Thank
Corrine,
you.
you and Carol do a great podcast, and I'm just honored to be part of it. But you both are deeply scientifically oriented, and you're doing reasonable reporting on what's new in the sciences, and you're being very helpful for so many people around the country. So, what a pleasure for me to join you. Thank you.
Oh, thank you for being here. You know what I just read today? I was blown away. Since you're a psychiatrist, I'll tell you, they said that giving antibiotics can prevent schizophrenia in certain groups of people. I was blown away. I said, get them on a parasite cleanse, and you might not have the schizophrenia.
Well, the challenge is there's lots of science which is being bought and paid for, and the results are not consistent with truth, but they're published nonetheless. So it's incumbent upon you and your doctors to be able to actually look at the literature and actually think about it for ourselves. Often the title of the research paper is not in any way indicative of what the content is. The title might say progesterone increases risk of heart disease, but when you look at the actual study, it shows that progesterone decreased the risk of heart disease. And you think, how did these people actually publish this? And the last thing we have to remind everybody about is that progesterone is not progestin. And 99% of the research in the literature is about
Yes.
these synthetic progestins. So they do not apply. The opposite applies to your health.
Thank you. And your website, again. Can you
It's
give your
simply,
website?
it's weeksmd.com.
Thank you. WEEKS.
Right.
Carol, your website.
My website is the wellnessbydesignproject.com. And we have, as some people are on our YouTube channel, Take Charge of Your Health Radio. We also have a Facebook page, say Take Charge of Your Health with Corinne and Carol. So we're getting social. We're getting
We're,
into the
we're
groove
getting
with social.
savvy.
Corinne.
We're also running a group on Facebook, Progesterone for Men. We'd love you to sign up, Dr. Weeks. We'd love your input.
Lovely. And I got to tell you, it's so cute because when I finally got involved with Facebook, my kids said, Dad, we've long since vacated Facebook. You're a decade.
There's quite a bit going on there, quite a
Yeah.
bit. And I'm Corrine Health, CORINNE Health.com. And on all of our websites, all three of us, there is so much information, so much understanding. Please take time, visit the websites, and feel free to read and go page to page and sign up for newsletters. And
And
thank you so much, Reggie. Thank you for helping us. Jeremy, thank you for helping us and making it all work. And we'll be back next week. Bye, Dr. Weeks.
bye now.
Bye.